Hi, Dr. Hyder. Okay, so now what we're going to do is I am going to show you how to do a note for someone who, let's say you want to do a note that you called and talked to the parent. That might not be a billable medication service. Maybe it was a 2-minute phone call or just something else that you wanted to document. I'm going to show you how to do that really quickly. Okay, so this is not what you would do for an E&M visit or a psych eval. It's just for a little odds and ends in between that you might want to document. Okay, so for this particular process, instead of going to appointments like I would for a scheduled service, I'm going to click on the Navigator button, just like I'm going to open a client chart. My buttons are a little bit crazy, but the process is going to be the same. My client is Tina Testing. That is a practice client that we have in the profiler system. So I'm going to load this chart. Okay, and what I want to do is to click on this button called Profile of Client. I will enlarge it a little bit so you can see it better. Your icon will look like a head with a green shirt on right underneath where we put that client ID number or name to pull up the client file. So I'm going to click Profile of Client. Okay, and I'm going to drag this down a little bit so I can see it better on my screen. Okay, and what we want to do here is we want to go to this tab at the top right underneath their age that says Plan of Care. I'm going to click there. All right, and where it says Cost Center, which just means program, on this little section of drop-down menus on the right-hand side, I'm going to select CAS-ICARE, which stands for Child and Adolescent Services Integrated Care. Okay. And then I'm going to choose this little dot over here on the left that says Planned Services. And the way I remember this is if I am planning to put a note in, I'm going to click on where it says Planned. Okay, so I've got Planned Services and I have Child and Adolescent Eye Care here. And I'm going to click on this button that says Filter List. Okay. Please don't be confused by the great list of services here. Okay. I have some duplicates on my screen that shouldn't be on yours. Okay. The service that we want to select is the one called Note to Chart. Now, if you have a lot like I do in your list, what I like to do is click on this heading here that says Service. And that will put the services in alphabetical order. Let me see if I can show you. So see, it starts with the C, D, E, and the services go down that way. So if that makes it a little bit easier, then you can scroll down to the N, Note to Chart, because that is the non-billable sort of for your informational note for our system. Okay, so you just do one click on it. If you click twice, which I will show you because it tends to freak people out when they accidentally do it, you'll see how that service is set up. If you get to this screen, just click on cancel, it's fine. And I'll say yes. Really, you just want one click on this Note to Chart so that it highlights and turns orange. Okay. And then I'm going to click on the Add Recorded Service button, which becomes available up there as soon as I have made a selection below. Okay. So unlike the appointment screen, this is not scheduled, so it won't pull automatically a date and time. So all you have to do to pull it is to click the box. And it's going to pull, today is at 6:37 p.m. on Tuesday. It's going to pull the current date and time. Okay, I'm going to click on this end date and time as well. So you put the date and time of when you made the phone call or when you're documenting something that happened. Okay. And then once you have your date and time there, and again, if you need to adjust this back, let's say the whatever I wanted to document, I did at 4. So I can just use my number keys to change the time here. And maybe it was just from 4 to 4:15. Okay, so that will be the date and time that I'm saying I did something for this person. The primary provider is me. It's going to be you when you're doing it. Delivery method is client not present. Again, you can change that with this little drop-down menu if you need to. So if I wanted to document, let's say, a telephone call, I could go down here where it says telephone. So the ones that you could use in this situation are telephone, client not present or attempted contact, even client present. If you weren't able to see the client for their appointment, but let's say something happened in the hallway you wanted to document. Okay, so you just pick the delivery method that best fits. I will caution you that not all of these are used by the child and adolescent clinic, namely the ones that say home visit for injection. Do not pick this. Obviously, that was saved in error. Intellectual disability services start with ID, and ITCN services are for the infant and toddler connection of Norfolk. That's our baby program. So all of these services that have a program hitting in the beginning, you don't have to worry with at all. So it would just be attempted contact, client not present, client present, or telephone, whichever makes the most sense. So I'm going to click on telephone in my imaginary example today. Okay. And again, my screen shows recipient code and address, but yours won't, so you don't have to worry about that. So the place of service is just where was this? Where did this take place? Okay. And here again, we see the progress note screen. Okay, and I can just click on the plus. Now, the thing about a note to chart is that it's non-billable. It's not like we're saying we saw them for a medication evaluation. So in this particular situation, you can just type freely. So you can say contacted Tina, that's my imaginary client, contacted Tina's mother in regards to side effect of vomiting after taking Concerta daily for the past 3 days. Okay, whatever it is. And then you just say left a voicemail or whatever the conversation was, that a new prescription was called into the pharmacy for Focalin. So this is just my example. We're trying something different, okay, with this particular client. Okay, there is a check ABC button here. So I can turn on the spell check if I want to. Of course, Concerta, Focalin, I hope I spelled the medications correctly, but it's going to show you if you have anything underlined or want to check the spelling on, okay? And again, once we select whatever it is that we would like to, whatever we've gotten our content straight, we go down here to where it says final signature. And I am going to lock my note because I've finished my note. So I'm going to click on that date box there. And then I'm going to click the OK here. And then my progress note is saved. And I can just click save. Okay. So now what do you do if you wanted to save that note? If I'm doing it from the appointment screen, I could just double click on it. But what do I do when I want to see the note I saved here? All you have to do is instead of planned, I'm going to switch to recorded services right here. Okay. And the only other thing to keep mindful of is this date up here. It'll show you the current date stuff. So if you want to see a note you put in yesterday, you can click on this down arrow. And for example, I can say from the 19th. So show me notes for child and adolescent eye care from the 19th to the 20th. Okay, and if I leave this CAS-ICARE little drop down marked there, then it's just going to show me notes for the eye care program. And I'm going to hit filter list. Okay, so I can see that I have saved an E&M progress note, E&M office established patient, as well as a note to chart. If I wanted to see either of these, I just double click on it. There's my service, and my note is stored right in this little box here. I can double click on it, and then here's the note that I just wrote. So there are different ways to do progress notes. One thing to just keep in mind is if it is a service that is scheduled, someone who is on your actual calendar to be seen, it is always beneficial to do it directly from the calendar. That way it doesn't actually accidentally get double booked by the support staff and you. But if it's just a, hey, left a voicemail for this parent or spoke to someone on the phone regarding a side effect or to address a concern, that one would be note to chart. If you have any questions or anything is confusing in relation to kind of what we're going over, please just let me know. I would be more than glad to help you. I'm going to go ahead and close this out. And thank you so much. I hope you have a great day. And please let me know if I can do anything else for you. Thank you.